Good day, this is Professor Will, CBMG PhD. And today's Tuesday, January 18th, 2022. It is 8:01 and 53 seconds, p.m. Eastern Standard Time. Today's research, boosting T cells. So let's hop to it here. Boosting T cells improves survival in mice with glioblastoma. Treatment with interleukin-7 revs up immune system against deadly brain tumor. Date, January 18, 2022. Source, Washington University, School of Medicine. A new study shows that treatment with an immune-boosting protein called interleukin-7, IL-7, in combination with radiation, improves survival in mice with glioblastoma. The study in mice suggests promise for a phase 1/2 clinical trial that investigating a long-acting type of IL-7 in patients with glioblastoma. Glioblastoma, an aggressive cancer in the brain or spinal cord, has proven stubbornly resistant to newer immunotherapies and radiation and chemotherapy. The standard treatment for glioblastoma results in fewer than 10% of patients surviving longer than 5 years after diagnosis. Radiation in combination with chemotherapy is a standard care for various cancers, including glioblastoma. Although beneficial against cancer, these treatments also can impair patients' T cells, known as lymphocytes, that are important for fighting infections. Many glioblastoma patients have low levels of T cells. Glioblastoma patients who have chronically low lymphocyte counts don't survive as long as patients with higher numbers of these T cells. Researchers knew that glioblastoma patients with low lymphocytes, surprisingly, also have low IL-7, which is a growth factor that supports T cells. Normally, people with low T cells should have a high level of IL-7. Researchers wanted to find out if giving IL-7 to patients could increase the number of T cells and, in the process, have a positive impact on survival. On average, control mice that received no treatment lived about 20 days after tumor implantation. The mice that received IL-7 alone lived about 30 days, and those that received radiation alone lived about 35 to 40 days. The mice that received a combination of radiation and IL-7 lived at least 40 days, and many were still alive at 90 days. The longest survival was in the mice that received a triple combination of chemotherapy, radiation, and IL-7, most of which lived at least 45 days, with many still alive at the 90-day mark. It is difficult to know how these increases in survival in mice might translate to people, and if any of these mice are surviving at least 3 months by adding IL-7. Researchers hoping to see some type of improvement in patients who are treated with IL-7. As a basis for comparison, the chemotherapy given for glioblastoma is called temozolomide, and it was first approved because it improved patient survival by an average of slightly over 2 months. In addition to increasing T cell numbers in the tumor and tumor's environment, IL-7 treatment increased T cells in the blood and immune organs, including the thymus, spleen, and lymph nodes, the investigators found. The therapy also reduced T regulatory cells, which are known to suppress the immune system in the microenvironment of brain tumors. Researchers also see evidence that IL-7 could be considered as a replacement for temozolomide, especially among nearly 70% of patients who have a type of tumor that does not respond well to this chemotherapy. The researchers explained that current immunotherapies, called immunocheckpoint inhibitors, work by taking the brakes off immune cells that are already present. And since so many glioblastoma patients have depleted T cell numbers, it is perhaps not surprising that immune checkpoint inhibitors have not proven effective. And if researchers are able to increase the number of T cells by giving IL-7, researchers would like to find out if adding immune checkpoint inhibitors would then increase T cell activity against the cancer cells. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.